In this video, I will be explaining the behavioral statements for Domain 2.2. Domain 2.2 has 9 behavioral statements, so it's important that you understand each behavioral statement so that you can be able to provide evidence for all of them. These are the behavioral statements for Domain 2.2. So for this domain, you need to provide evidence for at least 7 behavioral statements because that accounts for 75% of the evidence you would need to be successful or to have provided sufficient evidence for this domain. Behavioral statement A says establishing existing understanding and knowledge of health condition, medicine use for a patient, and the need for counseling. So whenever I'm looking at behavioral statements, the first thing I do is to just check what the behavioral statement requires of me. So I need to assess what the patient already knows about their medical condition, what do they know about their medicine, and then I find a counseling need. So if a patient comes to me, I ask them or I check what they already understand about the medical condition, which means I need to know the diagnosis and know what's being treated. I need to know about the medication, and then I need to establish a need for this specific counseling session, not just to counsel on anything. I'm establishing a clear need. So like I said, it's the condition, the medicine use, and establish a counseling need. So the evidence you can use here is you can check the doctor's notes, or you can check your own notes, or you can check on the prescription. Sometimes they write ICD-10 codes, so this can be an effective way to just assess, the condition, and just ask the patient. Ask the patient information, what do you understand about this condition? What do you understand about this medicine? If it's an inhaler, then maybe you check how they use it. You ask them to demonstrate, and you can provide evidence and annotate that, this is a picture whereby I ask the patient to demonstrate to me so that I can be able to assess what they already know about their medicine. Or you can develop a questionnaire where you ask this information about the medicine so that you know about so that you check what they already know about the condition and the medicine that they are treating. Behavioral statement B says counseling patients on safe and rational use of medicines and medical devices. This includes the selection, use, contraindications, storage, and side effects. Sometimes you'll find prescriptions that don't have medical devices, but a tablet is a medical device. Because a tablet is a formulation, it's a device that carries medicine in it. A suppository is a medical device because it is a suppository, it is a formulation that contains medicine. An inhaler is a medical device. That's the most famous one. Insulin pens are medical devices that carry medicine and stuff like that. So the important thing here is that you counsel the patient so that they can be able to use the medication safely, including selection, use, contraindications, storage, and side effects. So you select like the medication, what this medication is for, how is it used, contraindications with other food-drug interactions, that the patient would need to know about. How is it stored and the side effects? For instance, insulin. How is it used? You help them know when to inject. Contraindications, what foods they can't be eating on insulin. You can inform them, changing the injection site, where to store it. They can't just be storing it on top of, the cupboard or in the bathroom. It needs to be stored in the refrigerator. So you check with the patient if they have a refrigerator. Some patients may not have a refrigerator. So this information is necessary for this. Inform them of the side effects. You can include the packet inserts. You can use the EM guidance app. You can use the medicine label to just inform patients of all of this. Behavioral statement C says listening effectively using active and reflective listening techniques. So you need to listen effectively, use active and reflective listening. Active listening. What is active listening? So active listening focuses entirely on the speaker. It aims to understand their message and to respond appropriately. So you are actively listening. You are minimizing disturbances. You are focusing on them. You are nodding your head. You don't have your hands crossed to demonstrate. You don't want to focus or hear them out. So you are actively listening to them. And then reflective listening is paraphrasing or summarizing what the speaker is saying and then reflecting it back. So how I would go about this is maybe you ask them a question. So what do you understand about medicine A? And then they would say, I understand 1, 2, 3. And then you would then reflect by saying, Or from what you're saying, I am hearing you say that you understand how to use medicine A in this way and in that way. And this method, this thing that I just demonstrated is reflective listening. I'm reflecting back, you know. The evidence you can include an article on how you learned about active listening, how you eliminated distractions on counseling, you sitting across the patient, interacting with them, not holding your phone, in a private counseling area and stuff like that, so that you can be able to do all of these things that you aim to do in behavior statement C. Behavior statement D says using an appropriate counseling plan based on patient needs and ensuring the safe and effective use of medicine. So how do you plan to counsel the patient? In behavior statement A, you saw the need to counsel. If it's on an inhaler, what is the need? Maybe the patient does not know how to use Symbicort. They were using one inhaler before, so now it's a different one, so they need to know. So that's the need. But how will you go about it? What's the plan? So now you are formulating a plan on how you are going to counsel the patient. Can include where you're going to counsel the patient, what information to provide, how to meet the needs that you identified during the note-taking session, and how will you assess, the effectiveness of that. So you can develop like a checklist, a counseling plan based on the counseling needs of the patient, and you can establish like a counseling goal. So maybe if it's on the inhaler, is to ensure that they understand how to use the inhaler. Behavior statement E says maximizing opportunities for counseling and provision of information and advice to patients. So what this means is you used the best of every opportunity to counsel a patient. For instance, a patient who is new on insulin, I would counsel them in a private counseling area so that I'm able to have time with them and explain what insulin is, how to use it, where to inject, so I can maximize on counseling in an appropriate counseling area. So to maximize, you can consider, culture, religion, language as well. Does the patient understand English? Is the patient educated? If the patient is not educated, how will I ensure that the information I provide is easy to understand? So I'm not using medical terms. I'm not trying to tell the patient that this is acetaminophen. You could say that this is a painkiller. Or you can use a name that the people are, aware of. This is going to help you with the pain, and this is how you take it. Simple language, that's how you can maximize. Eliminating distractions is how you can maximize on counseling opportunities. Behavioral statement F is communicating in a manner that demonstrates sensitivity to alternative customs and approaches to healthcare. In rural areas, patients are more likely to see maybe a traditional healer before they come to the hospital. They are more likely to believe that, because of my religious beliefs, I'm not going to take 1, 2, 3. Because of my religious affiliations, I'm not going to take blood transfusions. So you need to be aware of these things. But how do you provide evidence about this? So you can ask them questions. Have a questionnaire. Hey, are you using any other, type of medication? Are you on complementary medicine? Are you getting medication from some other person besides, like a doctor, maybe a traditional healer? Ask those questions. Have a questionnaire. You can check on the use of complementary medicine or folk medicine, and because we know that they can interact with the medication that they get from the hospital. So, yeah, you can provide a template that you can use to assess all of these things and provide evidence for it and sign it, and yeah. Behavior statement G, using language including verbal and nonverbal cues that the patient is likely to understand. So it's a language, there's a verbal and nonverbal cues. So what language am I going to communicate with? How do I tailor the counseling needs to meet the patient's needs? I mean, how do I tailor counseling to meet the patient's needs? What language am I going to use? If it's an elderly person, do they understand English? How will I ensure that they learn? Will I need to have someone to translate? Those type of things. And then non-verbal cues, pointing, nodding, folding of hands. These are non-verbal ways of communicating. So if you notice that the patient is folding their arms, it could indicate something. I'm sure you are able to evaluate and assess non-verbal cues in your own relationships as well. Same as goes for a counseling session. So you need to be able to see some of these things and then apply them. In your case, if a patient is crossing their arms, what would that indicate to you? If their arms are relaxed, what does that indicate to you? If their eyebrows are flinched, what does that indicate to you? And then you are using nonverbal cues, pointing at the injection site for insulin, pointing on the medicine that may be an inhaler, on showing the instructions. Those are nonverbal cues. You are also not using vague terms or like crazy terms, acetaminophen. Maybe your patient understands, but try to use simple terms. Behavior statement H says, where appropriate, using instructional aid. So you use visual tools or hands-on demonstrations to explain, concepts, how to use the inhaler, so that the patient is able to understand. If there is an insert, you give the patient. If there's a visual aid, in the case of insulin, you give them a vaginal pessary, you give them, pictograms, demonstration on where to use the medical devices, written material like brochures on the condition and the medicine that's prescribed can be examples. Behavior statement I says obtaining feedback from the patient to confirm their understanding of the information provided during the counseling session. So after you have counseled the patient, what do they understand? How do you check this? An example, if you're using an inhaler, you can give them the inhaler and ask them to demonstrate to you. And then you can look out for areas or for gaps, and then you can expand on that knowledge. Then you can ask them to fill out a feedback form. Remember to close the patient details so that it shows that you maintain patient confidentiality. That's important. Again, for this domain 2.2, at least 7 behavior statements need to be addressed. So this explanation at least should bring you understanding on how understand the behavior statements before attempting to collect evidence. Because sometimes you collect evidence, when you try annotating, you see that there's evidence missing. So when you have a mind map, for instance, you're able to then clearly map out that for behavior statement A, this is the evidence I'll include. Behavior statement B, this is the evidence I'll include. And then you can be able to have an idea of the evidence you need to collect. So that when you collect the evidence for the domain, you are able to provide sufficient evidence on this.